Hi guys, thanks for clicking this link. I'm Dr. Christian Allard, Doctor of Chiropractic. If you're suffering from a disc bulge and experiencing some low back and neck pain, referred symptom down your arms or down your legs, and you've tried everything and nothing's worked, I might have the solution for you. First of all, it's important for you to know what a disc bulge is. So if you look at a normal vertebrae here, so you can see that the disc has some certain space and the disc is made of cartilage, and the middle of the part of the disc here is made of liquid, and that liquid here is the food to the disc. Now, in case of like those discs running out of that liquid here, what happens is the disc will start to tear like that here, and as it starts to tear, then typically it'll start to bulge. And if it bulges, it starts to give pressure to the nerves, and then it's actually become very painful. The pain goes down the legs or down the arms. It could also give some pins and needles numbness, but also weakness. A disc bulge can actually be caused by several things, several causes. The first thing is too much pressure down the disc. So for example, we see people actually putting too much pressure, so they could go to the gym or they could try to lift something too heavy, and the disc like literally collapses like that and starts to actually tear. Or it could also be the spine in a wrong position or bad position for a long period of time, and then the degenerative processes actually start to have their effect, and eventually the disc will actually wear faster. I have developed over the years a non-manipulative technique, so meaning without twisting the spine or without cracking the spine, using a shockwave machine, which is, in my opinion, very safe and very effective. The most important thing is to actually figure out where the problem comes from, so how it actually developed itself, and come up with a solution to actually make sure that you actually get rid of the symptom and you actually heal those areas properly. So we typically use either shockwave therapy or spinal decompression. So shockwave therapy has the effect of breaking down scar tissue. So if this area is all compressed like that here, shockwave therapy will actually start to break down the scar tissue and loosen and making sure that this area functions properly. And it could also be like the muscles in the front of the spine. And spinal decompression in itself will actually, the word speaks for itself, it'll decompress the spine by creating a traction. So it's not a traction that is, for example, like 10-15 minutes, but it's a 1 minute traction, and then the pressure decreases and it starts to pull again, and that mimics what you actually do when you walk, so the disc can actually hydrate themselves and that can actually heal properly. The treatments are performed with precision and with the slightest amount of force possible. Most patients are actually quite surprised at how little amount of force is required to do the treatment. Typically those treatments are performed where the patient's feeling an immediate feeling of increase of mobility and strength. If you want to try something completely different, which doesn't involve manipulating your spine, make sure you claim your voucher to the right of this video and you take an appointment either with me or one of my Proback practitioners. Hopefully we'll be able to help you, and thank you for watching this video.